Good morning, Professor Hawkins. My name is Latoya Anderson and one of your students, and I'll be presenting my final paper of the semester. Um, I definitely had a good experience in your class, by the way. I learned a lot, and thank you for that opportunity to be in your course. I chose my paper on palliative care. I chose palliative care, I hope I'm saying it right, because as a means of care for parents who are older and will continue to get older and possibly one day need care like this or would will want care like this. And so to get into it, palliative care is defined as care that is focused on improving the overall wellness of the individual with serious illness, like chronic illness such as cancer, COPD, um, Alzheimer's, dementia, and those are the ones that actually focus more on in this paper. So, for example, I have mentioned palliative care for cancer, and that is used for after chemotherapy and radiation is mainly what it's used for, to treat symptoms like nausea, um, weakness, and also to palliative care, especially in the cancer. Um, it's not just for the cancer patients; it's actually for help with family, help with decisions that they'll make. It will help them to kind of deal with your family members who are pretty much suffering or pretty much are who can't help themselves, and what can we do as their family to make it comfortable for them. It's pretty much what I got from this. Besides cancer, palliative care can be used in patients with dementia, and it's pretty much helps with pain management. It helps provide emotional, spiritual, psychological supports. It lends a hand with coping strategies for them and family. And that's what dementia, because dementia, it greatly impacts their cognitive, their memory, their judgment, their language, behavior. So when the from what I know about dementia, is really something that you can't, reverse. So it's just another thing just to make them feel comfortable. Um, and COPD, as we know, it's when you have trouble breathing, so you have shortness of breath, you definitely weak, you can't be active as you once were. So the plans for cognitive and goals for it is to, because it works for different people in different ways, but the main thing is to alleviate the symptoms that they're all having, educate them on the illness and the progression of it. Some of them will get progressively worse. How would they deal with that is the concept of the palliative care as well. Palliative care versus hospice care is when we receive palliative care, we can receive it at any stage of the illness. But with hospice care is more for the end of life care. It's for when you just want them to be comfortable and not in pain, and so that's what that compares to palliative care and hospice care. It's the differences of those. Hospice care you can come to the home. Palliative care could be more in the hospitals and the clinics. And another thing that's important with palliative care is that you still work with the individual's primary care doctors, their team of doctors. You can still see the doctors who you've been seeing. You just have extra team members like social workers, and you get more in-depth care than just the physical care with palliative care. And then you got a team of people who provide it for you. Your doctor really is the one who will refer you to this team. Teams of nurses, teams of physicians, teams of, like I previously said, social workers. And then they'll kind of just, to have a consultation with a palliative care member, you can go ahead and just talk to them, what's your concerns, or who they can go ahead and provide you help with who. And besides payments, most medical insurance pays for palliative care. Medicare, Medicaid can pay fully or partially. So at least that is a burden that you won't have to bear financially. I guess the benefits, it's just like the examples of it. You can get emotional support for yourself, spiritual support for your family, and just overall to be comfortable and have more care outside of just going to your physicians. So my overall conclusion of the paper is that palliative care is needed when you are really in a really intense condition, intense illness, especially cancer, especially ones that will eventually lead you to be in a hospice care. And even in hospice care, you can still have palliative care as well. So overall, it's appointed for older adults and their families to make decisions about certain care for certain illnesses, and palliative care will always be there no matter what, which will give you and your family peace of mind. So it is definitely highly recommended at a certain stage of your life and certain progression of illnesses. And I also myself personally have a parent who is who in a way has a COPD, but it's more progressive, so that to me will be something that we need to discuss with him as well, in my own personal opinions of things. So I hope I didn't ramble too much, but I thank you for listening to the video, and thank you for the time and the opportunity to present this paper. Okay. Have a good one.